At 46, Michael began to experience changes he hadn't anticipated so early in life. He found himself waking up to urinate 2, sometimes even 3 times each night. His urine stream had become weaker and slower, and occasionally it would stop altogether. He had to strain to finish. He reassured himself, it's just part of getting older. Nothing to worry about. But that's where he made a critical error. You see, Michael shared a common belief among men, that prostate issues are simply an inevitable consequence of aging. He failed to recognize that those frequent nighttime trips to the bathroom were actually warning signs. And more importantly, he didn't realize that neglecting those signs would only exacerbate the problem. The most surprising thing for Michael wasn't the diagnosis itself. It was the solution recommended. It wasn't a medication, or surgery, or some readily available supplement promising a cure. No, it was a straightforward daily practice. One that society often instills in men a sense of embarrassment about. One that many men either stop doing or keep hidden in silence, despite it potentially being the very thing that safeguards their long-term well-being. I'm referring to masturbation. Now, please don't turn away just yet. I'm not here to startle or amuse you. I'm Dr. Evelyn Blake, and I've dedicated my career to men's health for many years. What I'm about to share in this video is grounded in solid clinical findings, established biology, and genuine patient experiences. Today, we'll delve into 3 specific ways that regular ejaculation, yes, through masturbation, can benefit your prostate health, particularly after the age of 50. And no, this isn't about old wives' tales or locker room banter. This is about the profound connection between sexual function, hormonal balance, and overall male longevity. The third point I'm going to discuss is especially important. It's a hormonal recalibration that most doctors rarely even mention. And for many of my patients, this reset is the key to regaining not just their urinary comfort, but also their self-assurance, restful sleep, and overall vitality. What you're about to learn may completely transform how you perceive your body for the rest of your life. So, let's begin at the very source. Your prostate is approximately the size of a walnut, but don't let its small size deceive you. This tiny gland plays a crucial role in your sexual health, reproductive system, and overall well-being as a man. Every day, your prostate works diligently, silently. Its primary function is to produce a component of the seminal fluid that aids in transporting and nourishing your sperm. This fluid is abundant in enzymes, zinc, citric acid, and other compounds that safeguard sperm and help you maintain fertility. But the prostate doesn't just produce, it also stores. And that's where the difficulty arises for many men. Like any gland or manufacturing facility, if the substance it produces isn't used or released, it accumulates. And over time, this results in congestion. You can think of your prostate as being like a narrow pipe or a garden hose. If the fluid within isn't flushed out regularly, it thickens and stagnates. Eventually, this leads to pressure, inflammation, and yes, discomfort. In medical terms, we refer to this as prostatic congestion. It doesn't always show up on imaging, but its effects are very real. Men experiencing congestion often report a sensation of pressure in the pelvic region. They have trouble completely emptying their bladder. They wake up frequently during the night to urinate. Some even feel pain during or after intercourse. And many of these men are unaware that the cause is something they could be managing with a simple, natural, and shame-free routine. Now, let me share a story with you, because this isn't just theory. I witness it happening repeatedly in real life. Several years ago, a gentleman named Samuel came to my office. He was 68 years old, a retired engineer, a proud father, and a grandfather of 5. He was also deeply unhappy. He told me, "Doctor, I feel like I practically live in the bathroom. And when I'm not there, I'm constantly thinking about when I'll need to go again." He had difficulty sleeping. His PSA levels were elevated, and he confessed, with considerable embarrassment, that he hadn't ejaculated in over 5 years. Not through intimacy, not through masturbation, not at all. Why? Because he believed it was wrong. He had been raised with the notion that men of his age should leave that part of life behind them. But his prostate didn't get that message. His gland was congested, inflamed, and swollen to nearly twice its normal size. Now, compare that with another patient, Luis, the same age, also a grandfather, also retired. But unlike Samuel, Luis maintained a regular self-care routine. Nothing excessive, just 2 or 3 times a week. When he came in for his annual checkup, his results were excellent. Low PSA, strong urine flow, No nighttime bathroom trips. In fact, his ultrasound revealed a prostate more typical of a man in his late 30s. Same age, same generation, but two completely different outcomes. And it all came down to one thing: regular maintenance. I'm going to pause here for a moment. Now, let's delve a bit deeper into your hormones. Within your body, there's a hormone called DHT, which stands for dihydrotestosterone. It's a byproduct of testosterone. And in small quantities, DHT is very important. It helps you grow facial hair, deepens your voice, and fuels your libido. It's part of what makes a man a man. But here's the catch. An excess of DHT, especially when left unaddressed over time, is directly linked to prostate enlargement. Think of your prostate like a small engine. DHT is the fuel that keeps the motor running. But if the fuel pressure becomes too high, that engine overheats. This overheating manifests as inflammation, urinary problems, and that tight, uncomfortable sensation down there that many older men silently endure. So, what cools the engine down? You guessed it, ejaculation. Every time you ejaculate, your body essentially hits a reset button. DHT levels decrease, blood flow improves. The prostate is allowed to rest, flush, and recalibrate. That's not just some spiritual idea. That's science. Numerous studies have demonstrated that men who ejaculate more frequently tend to have lower DHT concentrations, a reduced risk of prostate complications, and often better sleep and reduced stress levels, too. It's not solely about sexual release. It's about hormonal equilibrium, a biological reset that alleviates pressure, inflammation, and long-term strain on the gland. I once had a pair of brothers come to my office, David and Julian, both in their 50s. They were practically twins in terms of lifestyle and genetics, except for one key difference. David believed that self-pleasure was immature, so he abstained completely. Julian, on the other hand, understood its health benefits and maintained a comfortable weekly rhythm. Their lab results told a stark tale. David's PSA was rising, his sleep was disrupted, and he was planning road trips based on restroom locations. Julian's markers were perfect, and he joked, "Doctor, I sleep like a teenager." The takeaway here is that regular, healthy ejaculation is more than just pleasurable, it's preventive medicine. Let's get even more specific. When you ejaculate, there's a mechanical process occurring beyond just hormones. You're not simply releasing fluid, your body is performing a flush, a complete cleaning cycle. The muscle contractions during ejaculation actually expel old seminal fluid, dead cells, and microscopic debris that accumulate inside your prostate over time. If that debris remains for too long, it hardens, blocks ducts, and triggers immune responses that can lead to inflammation or scarring. But a regular release is like running a rinse cycle through a filter. The ducts stay open, blood circulates freely, and fresh nutrients reach the tissue, keeping it healthy and responsive. I like to call this the high-pressure rinse, because that's precisely what it is, a natural reset and wash that your body is designed to do. One patient, Benjamin, told me, "I never realized how good I could feel until I started taking care of that part of myself again." He used to feel sluggish, tired, and disconnected. But with a consistent self-care practice, coupled with walking, hydration, and leafy greens, he said he felt 10 years younger within a month. This is the power of listening to your body. Now, this is where many men struggle, not with the biology, but with their beliefs. They'll say to me, "Dr. Blake, I'm not in my 20s anymore. Isn't that habit just for younger men?" No. And let me state it plainly. There is no age limit on taking care of your health. Do you stop brushing your teeth at 60? Do you stop eating vegetables at 70? Of course not. So why would you discontinue a natural, healthy process that helps your body function more effectively? Self-pleasure isn't about youth or lust, it's about care. It's about listening to your body, respecting its systems, and doing what keeps them running smoothly. One of my patients, Arthur, 70 years old, widowed, and reserved, came in not because of pain, but because of a quiet sadness. He said, "I don't feel like a man anymore." But within a few weeks of reclaiming ownership of his body, his energy returned, his posture improved, and his eyes appeared brighter. He told me something I'll never forget. "If I had known this 30 years ago, I would have loved my wife better, not just physically, but emotionally. I wouldn't have carried so much shame." And that moment, his honesty, his growth, that's why I create these videos, to show men like you that it's not too late. You don't have to accept decline. You don't have to feel ashamed of your needs, and you don't have to suffer in silence. So, now we've reached the end, and I want you to pause for a moment. You're standing at a crossroads. One path is familiar. It's the path most men are nudged toward, the silent path, the one that says, don't talk about it, don't do anything, just deal with it. That path leads to discomfort, interrupted sleep, and regret. But there's another way. It's the path of knowledge, of ownership, of saying, this is my body, and I choose to care for it openly, naturally, and without shame. By establishing a simple, regular routine of self-care, of release, of connection, you support 3 powerful outcomes. You keep your prostate flushed and clean, you lower DHT and protect your hormonal balance, and you restore tissue health and blood flow where it matters most. You don't need expensive treatments. You don't need miracle pills. You simply need your own body and the willingness to listen to it. If what I've shared today resonates with you, I want you to type engine in the comments. That tells me you understood the analogy and that you're ready to initiate the reset. And if you know another man who needs to hear this, please share this video with him. It might change his life in the same way it transformed Arthur's, David's, and Michael's. Click like, subscribe, and above all, begin caring for your body with respect, consistency, and wisdom. You deserve nothing less. I'm Dr. Evelyn Blake, and I'll see you in the next video.